It's Black Maternal Health Week, dedicated to amplifying voices behind really tragic statistics affecting Black mothers and our babies. America's maternal mortality rates are among the highest in the developed world. Black mothers die from complications related to pregnancy at roughly 2 to 3 times the rate of white, Hispanic, Asian American women. According to the CDC, Black women in the U.S. are also 50% more likely to have a premature baby than white women.
And that disparity exists regardless of income level or economic status. And it's becoming more recognized through the media, through public stories, even from celebrities such as Serena Williams. There's so many factors that need to be addressed, and it's not something that's going to be fixed by one person or one organization or one healthcare system.
The White House officially recognized Black Maternal Health Week last year, with the Biden administration promising to pursue policies to close the disparities in quality health care. We want to bring in Dr. Kyle Coley to really do our part to extend the conversation during this important week. And let's start at the beginning, at the why. Why do you think these statistics are the way that they are?
You know, Alex, for the longest time in medicine, we thought it was biological differences, that it's, more chronic health problems like hypertension, more risk of conditions like peripartum cardiomyopathy, where your heart weakens. But we're realizing more and more that's only a small piece of the pie. And the majority of the pie is actually differences in structural racism, differences in implicit bias that we do not recognize, and differences in access to care. And the reason we found this out is because if you look at preeclampsia, which is a condition that can develop during pregnancy, a Black woman in the U.S. is much more likely to have preeclampsia than a Black woman in another country. So we realize that it probably has less to do with biology and more to do with cultural differences.
When you talk about implicit biases, and really should probably talk about explicit biases under this umbrella as well, is there training that needs to be done, education, conversations with physicians about this?
So much. I mean, I feel like the needle has started to move in the right direction even during my career. So in medical school, for example, we never had training about implicit or explicit bias. But more recently, we started to have continuing medical education programs. But I think we're not doing enough. So there was just a survey from about 4 years ago in 2016, about 6 years ago, of white medical students. And greater than 50% of them had false impressions of Black people having biological differences that were not actually accurate. So that tells me that there's a lot of work to be done.
That is disturbing. And, you know, when we talk about Colorado specifically, there are very few Black doctors in this state. I've done some research on the topic, and less than 1% of doctors are Black. How does that exasperate these issues?
I think it just widens that gap that already exists, you know, and I think that there are studies out there that tell us, for example, that a Black baby treated by a Black doctor is less likely to die than a Black baby treated by a white doctor. But even in a Black doctor's hand, that Black baby does worse. So that tells us that across the board, we need to do, whether you're white, Hispanic, or Black, Indian, we really need more training and education around these issues. And people want doctors that look like them. People want healthcare providers that look like them. So we really need to work on training minorities up in the healthcare system.
And this is a national issue. It's such a nuanced issue, but how does it, I mean, how do we even start to kind of push that needle? You said some progress is being made, but like changes locally that could potentially change this in a broader sense.
I think what we're doing today is really important. Awareness and education is the most important piece. Recognize that there is a problem, then try to identify what are the factors contributing to that problem. And here we've already identified some, such as a lack of diversity in our healthcare force, and then really put in systems in place to try to address those. I also think social programs to try to improve access for healthcare to Black mothers, allow them to have the same sort of privileges, same sort of, you know, care for their babies in the entire peripartum period. Those are the next steps.
So it's encouraging to hear from Dr. Andrews, to hear from you, people that we trust in this community, that your eyes are on, know that this is something that you need to tackle, and progress is coming. So that makes you feel good. But in the meantime, last question, and we just got a wrap here, but how can we advocate as Black mothers for our own health care?
I think you have to, because until the system catches up, you have to be your own best advocate. The best way to do that is to know the warning signs of something bad: swollen ankles, shortness of breath, blurry vision, anything that doesn't feel right. Make sure you see your doctor. And the second is to create a network around you, family members and healthcare providers that you trust and look up to.
It takes a village.
It does.
Dr. Coley, we appreciate you. Thank you.